Hotspots, if you have a dog, especially if it's a long-haired dog, for example, it's very possible that he or she may have one. I would recommend year-round prevention, even if the risk is less so in the winter months.
So they make a call to you, they bring your dog in, they got a hot spot. How do you treat it?
Yeah, I mean, I guess I would ask some questions before going ahead with treatment. You know, there are diagnostics that can definitely and sometimes should definitely be done before empiric treatment. But oftentimes, I will be honest, the case, you know, I can mention to the owners, you know, the utility of doing an impression smear where we kind of put a glass slide up against one of those aforementioned pustules that, you know, pop it so we can get that pus and bacteria, get it on the slide, take a look under the microscope, look for specific types of cells, bacteria, neutrophils. You know, that can be very useful baseline diagnostic. Most owners really don't care. They just want to treat it. And I get that, like, and I don't always do, you know, cytologies, and don't jump to like the more extensive diagnostics, especially if they're not considering that. So typically how will I treat it? I'll shave the area, you know, a little bit past where I'm seeing initial redness or pus, and until I kind of see healthy skin. Shave that area. We have like chlorhexidine, gluconate, topical wipes, kind of clean that up, and then I'll send home with antibiotics. I usually choose cefpodoxime, and, you know, recommend once a day. And depending on the severity, or if I see any evidence of like folliculitis and, you know, some hair follicles that are affected, I may do a longer course than I would otherwise. But typically what owners should be thinking about are, you know, on the order of 3 to 4 to maybe 6 to 8 weeks for, you know, really, really bad lesions. And we'll talk. I know some of the questions in here may, you know, come up with, you know, home remedies and homeopathic flavors to stuff. But I am of the mindset that antibiotics are super important. Now, there are topical ones, and then there are the oral systemic ones, like the cefpodoxime, and which can definitely cause some adverse reactions. You know, you can see gastrointestinal upset when we give that. But for me, in the vast majority of cases, the benefits outweigh the risks, because the dog needs, like, the mainstay of therapy here is antibiotics.
Do you prefer topical versus oral, or do you prefer oral?
Yeah, I mean, you'll ask one vet, you'll get, or 2 vets, you'll get 3 opinions, especially those who, you know, are more into the homeopathic trend. And there's, you know, the multiple ways to skin a cat, give the reference.
Or skin on the cat. Yeah,
exactly. The multiple ways to skin on a cat. The goal here is to just stop the trauma and to prevent development of future trauma. And so, you know, sometimes cost is an issue. You know, if I have multiple patients in one day to treat, you know, the same essential thing, which is a hotspot, which is often the case because skin and vomiting, diarrhea are like the 2 most commonly commonly seen histories that I'll see in a given day. But I may treat them very differently, depending on owners' wishes, owners' comfort levels, like giving oral meds. Oral medication is generally some of the easiest things to do, but a lot of people do, you know, for, you know, if they may have disability or they have, you know, problems opening the mouth, like, or they think the dog, you know, they'll hide it in a treat, but their dog's too smart, which is often the case. You know, there are a lot of challenges when it comes to, there's no one size fits all therapy. So generally speaking, I'm pro oral systemic antibiotics for hotspots, but I will not end up prescribing that to all my patients. But in some form, whether it's, topical, shampoos, so chlorhexidine shampoos, or miconazole, which is an antifungal, but has antibacterial properties. That's also a really good one. And it really depends. But I'm always going to recommend what I think would be best, which is pretty much always usually cefpodoxime. And that's really based on the typical susceptibility patterns of staph, pseudointermedius, which is one of like the main bacteria that's going to be colonizing on our skin, and that can kind of get in the area and then start to proliferate. So because I know cefpodoxime is going to be indicated for that species, that's the one that I almost always choose.
How do your treatments vary for the underlying conditions, be it dog's got fleas, the dog's got whatever, the dog's got a food allergy, the reason why they're itchy and scratchy, how does that affect your treatment?
Yeah, I mean, that's huge. I always tell the owners, like, this didn't happen out of the blue. Like, there had to be some sort of stimulus that triggered it. And we may not always find out on the physical exam or based on what the owner has provided to me in the history. We may not know what is the cause for it, but we like to control for some of the biggest ones. And I definitely think flea allergy dermatitis is a huge one. And I always recommend that an owner will, especially if they are not currently, up to date on a monthly preventative, or, every 4 times a year, if it's something like Bravecto, chewable that lasts for 3 months at a time. I always recommend that they get on that. But definitely, like, I'm going to do a full physical exam for every patient that comes to see me. And, if we see a lot of inflammation in the ear canals, or that's kind of the back of the ear is where I'm seeing the excoriations and kind of the redness or, bleeding or anything, we'll do a swab. I'll recommend an ear cytology. We'll try to start treating the underlying cause. And that could be, some otic solution in the ear canals. It could be ear mites. It could be, who knows? It could be anything. Yeah. Yeast, rod-shaped bacteria, spherical, like cocci. So all sorts of different things.
So basically, you're a detective at this point. You're trying to figure out, and you have to treat the underlying condition, because if you just treat the hot spot, you put cream on it, you shave it. Well, if the dog's going to be itchy, it's going to happen again and again and again. Yeah. And that's something we have to communicate with owners and say, listen, I know you don't want to spend extra money for ear swab or whatever it is, but you're going to keep coming back for this, or you're going to try to treat it at home, and then it's going to get worse. How much do you normally shave? Say on a quarter-sized lesion, like how far out do you go?
Yeah, I mean, I think going at least another centimeter or 2 around it would be sufficient. As soon as I kind of see the nice, healthy underlying skin beneath the hair. But yeah, I'm pretty liberal when it comes to that, unless an owner, like, not even unless, like, they'll demonstrate. Most of the time, people are, pretty understanding that this needs to be done, and they're cool with it. But, periodically they'll be like, oh, don't do this. But, we need to see what we need to see. So I try to, my hands will be all over their pet, not even just in the specific area that they're worried about or that the dog's been licking. So if I feel, some sort of crust or something moist in a different part of the dog, I'm going to recommend that we also shave that area, because sometimes these things can kind of fly under the radar.
Right. Yeah. My poor dog looked like a checkerboard when I would get done with him, because I'd be petting him and go, hotspot, and bring him into work and just shave a big old square around it, and then there's another one, shave it and get him on antibiotics. So that's a constant battle. So
poor Dale.
I know, he was a great dog, but he got a little weird with his brain tumor though. He started having seizures, and then it was one of those things where, I worked at a specialty clinic with neurologists. So like I'd bring him in and go, help me. And they would look at him and see like half his face is a little sunk in, and they would say, okay, something's probably going on over here. And we put him on anti-seizure medication, and that stopped his seizures, but it completely changed his personality. He was no longer the dog I knew. He'd walk around like, oh, this is new. Hi, who are you? What's going on? And it got to the point where he snapped at my kid at the time who was a baby, and he would never do that ever. So it was like, I can't have him around with possibly hurting the baby. So we had to put him down, but it was tough. But anyway, that's a sad story. We're not doing sad stories. We're talking about hotspots. Home remedies for hotspots. Do you recommend people do home remedies for hotspots? Pouring witch hazel or essential oils on a hotspot at home? Do you think any of that helps?
I don't. I would definitely recommend.
I'm gonna get you in trouble with all the essential oil people.
Right. Well, come at me, bro. Essential oil people.
I put peppermint on there. Yeah.
Everyone wants to do what's best for their pet, and there's a lot of there are a lot of natural treatments out there that can be helpful. And like with whatever anti-epileptic drug that Dale was on, kind of circling back to that, no drug is benign. So even the antibiotics, which I pretty much always will be recommending for hotspots, I always alert the owners, for potential side effects. And there are a lot of homeopathic and home remedies that, I did a Google search and preparing for this to kind of see what's out there.
Let's hear it.
Hydrogen peroxide, I saw some sites that say definitely. And then I'm thinking in my head, no, let's not do that.
Why not? Why would you not recommend
H2O2? Yeah, H2O2 is, we have it in the clinic, we have it in our houses, in the cabinets, and it's a readily available option. So I definitely understand why people think that it's good for for us sometimes, scrapes and but it burns, and I do feel that the science behind the oxidative damage and while it will kill a lot of surface bacteria, it's going to delay the healing process by also kind of interfering with the body's response to the trauma and potentially like slow healing. Right. So and it burns. It really is no fun. But I did see other things.
And it's also one of those things where it when we would get blood on our scrubs, we'd spray hydrogen peroxide on it because it breaks it down. It's easier to clean out. Yeah. If you want something to clot or to heal up, why are you dumping something that's kind of caustic on there? You're right. I think it burns. It's bubbling. It's working. And meanwhile, your dog is screaming around the house.
Pretty much. Definitely no fun. So that's something that I would avoid. I saw calendula, which it's a little salve that we have from the marigold plant. Okay. It has some anti-inflammatory properties that if an owner if it's cost prohibitive to come to the hospital, obviously we would like to see their pet, because we need to kind of diagnose officially, because it could be something else, but that could be a good option. Aloe vera can be soothing. We don't want obviously our dogs to be licking this, so definitely the e-collar for sure is a must. I mean, it's really half the battle, just preventing them from licking the lesion.
I was going to get into that next. Yeah.
Yeah. So, I mean, that's half a home remedy in and of itself. You know, if an owner is vaxxer, anti-antibiotics, you know, no drugs for my dog, which we do have a lot of. I have a lot of clients who are like that. But when push comes to shove, depending on the severity of, you know, if it's skin lesion or gastrointestinal upset or whatever the case may be, then, you know, if it's causing too much of, they decide it, you know, they call it on their terms. But if it's really, they understand that this is a big deal, then they'll obviously opt for certain diagnostics or, you know, drugs. But there are a lot of people who don't want that for their pets, for whatever reasons it may be. But yeah,
I like my dog like I like my chicken with no antibiotics.
There you go. GMO free.
That's right, no hormones.
Not GMO. But yeah, so I think calendula is a good one.
Okay.
Yeah.
So in terms of keeping your dog from licking, can you tell them stop licking? And they're going to listen to you, right? That's what dogs do, isn't it? Don't they just stop when you tell them no?
Yeah. If only they could, you know, if only we could talk to the animals. Who was it who sung that?
Talk to the animals, walk with the animals.
Yeah.
Oh, I'm gonna have to go
gosh. Something Junior. Sammy Davis Jr.
Okay.
So anyway, if only we could talk to the animals. We can. They're not going to talk back. And if they did, they would be like, "Hell no, I'm going to be licking this."
So what do you do? How do you keep them from licking it?
So the cone of shame, Mike. That's the answer. The cone of shame, the Elizabethan collar. Yep. That's the key. Now, some owners don't like that. They want the soft collar. And I'm okay with that so long as it's truly going to prevent that, like depending on the location of the hotspot. For soft collars, they could probably potentially still reach at the tail. But if it's kind of, you know, on the back or the flank, the soft collar might do the trick. But you just need to create some barrier from the mouth to the actual lesion. And I always recommend to owners, and sometimes, you know, while they're sleeping or at the house, they'll put it on, but throughout the day, if they're home, especially now during COVID, when a lot of people are homebound, they'll, you know, have it off because the dog is happier, but they'll just monitor from the background. But inevitably, like, the dog will still be licking, and the proof is in the pudding, because when I see them back for a recheck or something, you can tell. Right. You know, you see the surrounding hair that might be a little bit, you know, wet, or you know it's happened. So, you know, but the most we can do is, you know, recommend, and you know, hopefully the owners will, you know, listen.
Yeah.